Hi everyone, I'm Jade Mills and I will be providing the pharmacy updates for the month of February. In this presentation, I will cover medications that have received FDA approval, FDA label change, highlight revisions to ACC guidelines for heart failure, and review formulary additions for Cone Health. First, I will review new medications that have recently received FDA approval. Gemtesa or Vibragron is a beta-3 adrenergic agonist approved for the treatment of overactive bladder. It is a 75 milligram tablet given orally once daily. In comparison to Myrbetriq, another beta-3 adrenergic agonist, Vibragron does not have a warning for angioedema and blood pressure effects. It has a shorter half-life and it does not require titration. Cabenuva is the first FDA-approved extended-release injectable drug regimen for patients with HIV type 1. It is a combination of cabotegravir, an integrase inhibitor, and rilpivirine, a non-nucleoside reverse transcriptase inhibitor. Cabenuva is administered via IM gluteal injection and given once monthly. Prior to initiating Cabenuva, it is recommended that patients receive 1 month of oral treatment to assess tolerability. Vocabria is the oral formulation of cabotegravir and was also FDA approved for HIV type 1 treatment. It is to be used in combination with oral rilpivirine for 1 month prior to starting Cabenuva. This is to ensure that the patient is able to tolerate these medications before switching to the combination extended-release injection. Evinacumab, or Evkeeza, is a monoclonal antibody approved for the treatment of homozygous familial hypercholesterolemia as add-on therapy to other LDL-lowering therapies such as our statins and PCSK9 inhibitors. This is approved in patients 12 years of age and older. Evinacumab works by inhibiting the angiopoietin-like 3 protein, which is important for regulation of lipid metabolism. It inhibits this protein, leading to reduced LDL levels. It is administered as an IV infusion once monthly at a dose of 15 milligrams per kilogram. Evkeeza's approval is based on the results from the ELLIPSE trial. This was a randomized controlled trial with the primary endpoint of % change in LDL from baseline to week 24 in patients on a statin and PCSK9 inhibitor. Evinacumab has a 47% reduction in LDL. Evinacumab has also been studied and showed to be effective with subcutaneous dosing and in patients with or without heterozygous familial hypercholesterolemia. Vericiguat, brand name Recuvo, received FDA approval for the treatment of symptomatic chronic heart failure in January of this year. Guanylate cyclase plays an important role in cardiac muscle relaxation. Vericiguat works by stimulating guanylate cyclase, which leads to accumulation of cGMP, resulting in smooth muscle relaxation and vasodilation. Based on results from animal reproduction studies showing fetal harm, Vericiguat is contraindicated in pregnancy. It is the first guanylate cyclase stimulator to receive FDA approval. Its approval was based on results from the Victoria trial. The results from the trial showed that Vericiguat had a greater reduction in death from cardiovascular causes or heart failure hospitalizations than placebo, with a significant outcome and a number needed to treat of 33. Next, I will discuss a new FDA label change. Entresto is a combination of sacubitril, a neprilysin inhibitor, and valsartan, an angiotensin II receptor blocker. It is indicated to reduce the risk of cardiovascular death and hospitalization for chronic heart failure in patients with NYHA class 2 to 4 and reduced ejection fraction. On February 2021, this medication was approved to also be used in patients with HFpEF based on the results of the Paragon trial. The purpose of this trial was to assess long-term efficacy and safety of Entresto compared to valsartan in patients with left ventricular ejection fraction greater than or equal to 45% and structural heart disease. The study's primary endpoint was the composite of cardiovascular death and total heart failure hospitalizations. The trial missed statistical significance for its primary endpoint and the treatment effect was primarily driven by heart failure hospitalizations. There was a greater treatment effect noticed in the subgroup analyses for patients with ejection fraction less than or equal to 57% and in women. Entresto is the first heart failure therapy with an FDA approval for HFpEF. Next, I will highlight key medication therapy additions to the 2021 ACC heart failure guidelines. In January of this year, the American College of Cardiology released a 2021 update to its heart failure guidelines. Entresto, which I previously mentioned, is a combination of an ARB and neprilysin inhibitor, or ARNI for short. Entresto is preferred for first-line treatment of heart failure. If patients are unable to take Entresto, then an ARB or ACE inhibitor should be initiated. I also wanted to highlight SGLT2 inhibitors have been included as an add-on therapy as there is evidence showing that they reduce the risk for major events such as hospitalization or death, regardless of the presence of diabetes. SGLT2 inhibitors are added in as part of the therapy for patients with chronic heart failure who are already receiving Entresto or ACE inhibitor or ARB and beta blockers. Lastly, I will cover new medications that have been added to the Cone Health formulary. Melatonin has data for regulating circadian rhythms and promoting sleep. It is becoming a common dietary supplement in the outpatient setting for this indication. However, it is not an FDA-approved medication. With non-formulary orders for melatonin continuing to increase in our hospitals, it was recommended that melatonin be added to the formulary. To assure product quality, only USP-verified melatonin supplements will be available in formulary. Yupelri is a long-acting muscarinic antagonist used for the treatment of acute exacerbations of COPD. It is administered via a nebulizer device, which can be a beneficial formulation during exacerbations or severe COPD, as patients may have difficulty with other LAMAs that are dry powder inhalers. The recommended dose is 1 3 milliliter vial nebulized once daily. In summary, there have been several advances in medication therapy within the past few months, from new FDA approvals to guideline revisions, and also Cone Health has added 2 noteworthy additions to the formulary, melatonin and a new LAMA nebulizer, Yupelri. Special thanks to Mariah Gibbs and Mary Taylor for their contributions to developing this presentation. I hope you enjoyed this update. Thank you.